Good morning, everyone, and thank you for joining us for this week's Lunch and Learn. I'm Tony Ross, Director of Communications at Provalis Research. Today's presentation is balancing the insights of human interpretation with the power of qualitative software, analyzing COVID-19 habits using WordStat and QDA Miner. We're pleased to have with us today three presenters, Dr. Christina Silver, Dr. Eric Wastland, and Dr. Suraj Nojade. Christina is a recognized trainer of Provalis Research software. She's been using, teaching, and consulting in qualitative software since the 1990s. She has trained more than 9,000 researchers around the world. She manages CAQDAS networking project based in the Department of Sociology in the University of Surrey in Guildford, UK, leading the training and capacity building activities. The project provides information, advice, and training in a range of software packages, including QDA Miner and WordStat, Christina regularly runs workshops in research design using software to undertake literature reviews, qualitative data analysis, mixed methods, and 5-level QDA method. Her contact information is available on the training section of the Provalis website and as part of this presentation. Eric Wastland has a PhD in psychology and is an associate professor and a senior researcher at CTF, the Service Research Center at Karlstad University in Sweden. His research revolves around how technology can be used to enhance services. Suraj Nojade has a PhD in psychology and teaches at Karlstad University, mainly in communications, interview techniques, and organizational psychology. His research involves a broad collaboration with local and national activities. He and Eric have collaborated on at least 2 papers, Bridging the Valuescape with Digital Technology, a mixed method study on customers' value creation process in the physical retail space, 2020, and the how, what, and why of digitalizing physical retail spaces, 2019. I'd ask everybody when you join to please turn off your screens and mute your microphones. At the end of the presentation, if you wish to ask questions, please send them to us through the chat feature at the top right of your screen. We'll take as many as time allows. And now I'll turn the presentation over to Eric.
Okay, thank you, Tony, for having us and allowing us to present our research. So me and Sture, we work at the CTF, the Service Research Center, and we're approximately 60 researchers who conduct research among a lot of different topics regarding to services. And this image that you're looking at here is from what we call our fika sofa. It's where we have coffee, and this picture was taken by our communication department. And the reason they created this picture was that so that we could bring it along whenever we were traveling around the world to international conferences, etc. And we could talk about the cozy environment at our research department, and also talk about the many guests who came in to visit us and how much they enjoyed sitting in this fika sofa. Of course, then suddenly something happened which pretty much changed everything. A black swan appeared and we no longer could travel to see other people, and no other people came to visit us in our fika sofa. And actually what was once a very cozy place turned into a rather bleak representation of itself, and this is how it currently looks. So during I guess a couple of weeks, everything slowed down. As we all know, about a year ago, this of course happened. Everything started slowing down, everything changed, and we couldn't do what we had been doing. We had to change the way we were teaching, we had to change the way we were interacting with each other. We no longer could have guests, etc. So in one way, everything stopped, and in one way we could not keep doing what we were doing. But at the same time, nothing really stopped, because we kept doing very many things that we were doing. We kept teaching, we kept doing at least parts of our research, and we kept communicating amongst each other or amongst ourselves at the department, and also with everybody else around the world, even if we didn't go to travel there. So in many ways, everything changed, but we kept, and we all, everybody kept doing things. So in regards to our research, we had to stop doing many of the things we were doing, since many of the things we were doing involved meeting people at workshops or meeting people for interviews, or going out to businesses or other types of organizations and participating in whatever they were doing. And of course, this had to stop. And we also did a lot of research together with healthcare professionals. And of course, they did not want to meet us because they were pretty busy with handling sick people within the pandemic. But one thing that we started to discuss was what can we investigate now that we could not investigate before. We tried to view the situation as a unique situation where we could study things that previously had not been possible to study. We were thinking that we were trying to catch an opportunity when it happened. And in one way, of course, that will be the case. But we honestly thought that we were catching something that was going to happen throughout last spring and would be sort of gone away by summer. That, of course, was not the case. But when we were looking at our own, what we were doing, we realized that we were doing a lot of the same things as before, but we were using digital technology to aid us in doing so. So digitalization had accelerated, and we could see that it had also accentuated both positive and negative aspects. So this is what we wanted to study. Now, from a CTF perspective, we look at services and service experiences and how these experiences create value for the users of these services. This is sort of an overview or image of what we're doing. We're also looking then at factors which enhance these experiences and factors which disrupt the value creation experience. And this is sort of like one of the main points of what we're doing. We're looking at how customers co-create value when they interact with the services. And some of the previous studies that we have been involved with, as Tony was talking about, we've been looking at how people interact with physical retail spaces or city centers or shopping malls, etc., and how they create value and with the role of digital technology in such interactions. We have been looking at how value is created during health and welfare services, and how digitalization can be used throughout these services. And we have looked at how digitalization can help people to change their habits or change their behavior. And we have done quite a lot of studies on behavior change. Now, in one way, we can look at habits as repetitive behaviors that we keep doing, and we do them because at least we do them by our own volition. We can look at them as three different types of behaviors: things that we have to do, things that we want to do, and things that we should do and not really want to do. And the pandemic changed all these three things, or three types of habits. So from then an overall or overarching perspective, this is what we wanted to study. When everything changes and we can't continue doing things that we used to do, what are we doing instead? What happens to our habits? Because this is something that we obviously noticed with ourselves, that we stopped doing things and we started doing other things. More specifically, we wanted to know how has the pandemic affected people's habits, and what is the role of technology in these new habits. So this is what we set out to investigate when we rolled out our questionnaire. And what we decided to do then was to invite people via social media. And this is an example of an Instagram ad. We bought ads on Instagram, and we bought ads on Facebook, and this was actually a rather cheap way to get in contact with a lot of people. We also got a lot of well, I'm not going to complain, but rather abusive responses regarding our intentions and if we were or not were part of a conspiracy to I don't know. Well, anyhow, this is at least how we collected the participants in the study. So all in all, I think we sent out something like 100,000 ads or whatnot all around the world. And so we had an online survey. We had it translated into 7 different languages. And it basically consisted of a few demographic questions and then 4 open-ended questions. And these 4 open-ended questions then related to people's habits that they had acquired during the pandemic and that they were happy with. They regarded habits that they had started up but wanted to quit, and things that they did not do now that they long for. So these were basically the questions that we were asking. And the results from these questions was, so the data was, we got more than 1,200 participants who answered at least one of these questions. We also had respondents coming from more than 25 countries, and all in all, the data consisted of more than 75,000 words. And when we started looking at this data, we sort of realized that we had gotten ourselves out into the deep end of the swimming pool, because we did not really know how to analyze such amounts of data. And that is when we came up with the idea that we needed somehow needed to use some type of computerized support or aid system to do this, and that's of course when we started, or that's when we started looking around, and we found Christina, and that's when we contacted her in order to get her to help us to figure out how to approach this massive amount of information. And now I'm going to try to turn over to Christina. Oh, there you are, sorry. Excellent. And now you should be able to present. And now Christina will tell you more about how we actually approach the problem of analyzing this data.
Okay, thank you, Eric, for that great introduction. So I'm Christina, and Eric and Sture contacted me back in the summer, and we started talking about how QDAMiner and WordStat could help with their analysis. It became clear to us in our early discussions that they needed to come to a balance between the interpretations that they, as analysts, could bring to the data with the assistance that the use of software could provide. So if we think of methods of analyzing qualitative data on a continuum, then another way of thinking about this is to balance and combine qualitative analytic methods with more quantitative analytic methods. And we wanted to develop an analysis plan that balanced methods, also the tools that we were using, and the human interpretations. And that's really where QDAMiner and WordStat come in, as each of these programs contain tools that we could harness iteratively and at different stages of our work without compromising the understanding that we had of the context. So some of the context that Eric described about why they decided to do this study, and some of the context that we as humans who are living through the pandemic can bring to the data. So we wanted to balance those understandings, those human interpretations, with the power that the software could provide in terms of doing the analysis as well. So in that sense, I'm going to present to you aspects of the analysis plan that we developed together, and that analysis plan straddles the methods. And as we moved along this continuum from human interpretation and more qualitative analytic methods to the computer assistance and more quantitative analytic methods, as we used tools from both QDAMiner and WordStat iteratively through the process. So here is a high-level overview of the key stages in the process. I'm going to break down the first 4 stages that you can see there: planning, dictionary building, coding, and identifying patterns and relationships in the next few slides. But there are 2 important things to understand about this high-level process before I move on to do that. First of all, this is work in progress. So stages 5 and 6, which are displayed here in a light grey colour, they're not yet underway. In fact, we're at the point of coming towards the end of stage 4 and currently transitioning into stage 5. And that kind of brings me on to the second important point, which is that, as I'll explain a little bit more later on, we're not entirely sure exactly what's going to happen in stages 5 and 6. We've started planning them, and in fact, we started thinking and planning each stage before embarking on it. But as is very characteristic of all qualitative and mixed methods analysis plans, they were developed iteratively. So that means that some plans are changing as earlier stages happen. So although we were planning right from the outset, we were very open and flexible to the idea that the findings that were being developed through the analysis that Sture and Eric were doing would mean that the plan would need to be tweaked and changed as new directions and new insights came to light. Okay, so let's look at this in a little bit more detail. So this is more detail of each stage. So basically the analytic activities that were undertaken at each stage. And you'll see by looking at this that the analysis plan that we developed together is being revisited and adjusted at several stages, as I just mentioned. So that's natural because it's never possible to plan an entire qualitative or mixed methods analysis in one fell swoop. So in particular, just to notice at this stage that the initial analysis plan we designed in the planning stage, and then that was reviewed and adjusted during stage 3, and then again in stage 4, and that's likely to continue happening. So this is more detailed than the previous diagram, but we can actually break each of these stages down even further. So one of the ways that I conceptualize this plan and many of the plans that I developed for other projects is that the numbered yellow boxes that you can see here represent the high-level stages, and within each of those are the activities that are undertaken. So I'll now move on and describe how some of these activities were actually undertaken within QDAMiner and WordStat. So let's just take the initial planning stage. So you can see that first of all was a familiarization activity. And actually we focused on 2 aspects of familiarization. First of all, familiarizing with the data itself. So as Eric mentioned, the data was collected from an online survey. So at the outset, we didn't have an overall understanding of the content of all of the data because of the way it was collected. If it had been interview data and we had undertaken the interviews ourselves and transcribed the interviews, we'd be very familiar with the data right at this planning stage. But when you're working with data that's collected online, then of course that familiarity is really important. So part of familiarizing with data and subsets of the data, including looking at the individual open-ended questions. If you remember, there were 4 open-ended questions Eric described earlier about different aspects of habits and things that had changed or not. So familiarization was really important, and that familiarization with the data always informs the analysis plan. But the other aspect of familiarization was facilitating, my role at this stage was really in facilitating Eric and Sture to familiarize with the capabilities of the Provalis tools. So I'd used these tools previously for other projects, but they were new to Eric and Sture. So part of this familiarization was that it was important for them to know what's possible analytically with the software, as that also informs the plan of what's actually going to happen. So the strategies level, methodologically speaking, in terms of what they wanted to be able to do with their data, needed to be balanced with the tactics level, the level of the software, in terms of how and what tasks can be accomplished. So that really leads into the idea that the design of the initial analytic plan was very much a balance between methodological needs, practical needs, also the team working aspects, and the technological objectives. So all of those were feeding into our initial plan. The data preparation aspect involved lots of organizing the data and cleaning the data in order that it was in a good state for analysis through QDAMiner and WordStat. So that involved some work in Excel initially. And then we brought the data into QDAMiner and organized various things. And we did a little bit of recoding work of the variables at that stage in order that we would be able to have more focused analysis based on the recoding capabilities of variables in QDAMiner. So we initially brought the data into QDAMiner. Okay, so let's move on and think about stage 2, which was all about dictionary building. And as you may know, dictionary building can happen in a very powerful way using WordStat. So we moved from QDAMiner into WordStat, so opening WordStat on our QDAMiner dataset because the sophisticated tools allowed us to initially mine the data for content. And we used tools such as word frequencies, extracting phrases, looking at the named entities, misspellings and suggestion tools available in WordStat to help us explore in even more depth than we had done already the data with the aim of building categories. So hand in hand with that exploration phase, actually, in fact, these slides I'm showing you kind of imply that the different activities, so here exploration, category building, category refinement and validity checks, it kind of suggests this visualization that they are discrete activities that kind of sequentially build on one another. And that's really only partly true, I would say. Really, all of these activities were kind of happening concurrently. So we were iteratively going backwards and forwards between these certain tasks. And the software really facilitates that moving backwards and forwards because, of course, the building of categories and subcategories needs to be focused around the actual data. So you can see on this slide a couple of times we've got the term KWIC, quick, which stands for keyword in context. And that's a very powerful tool that you have or facility that you have in both WordStat and QDAMiner that allowed us to not just look at frequently occurring phrases or words or entities, whatever, but to look at those in the actual context within which they're used. And so that's one way in which the human interpretation and the software is being balanced or used concurrently. So another example of that iteration is this idea of validity checking. So what we mean by that is checking that the categories, as we're developing them, are actually capturing what we intend them to capture. So we had a partly deductive approach to thinking about the categories, in the sense that Eric and Sture knew what they wanted to look for or find or explore, investigate in the data, but they also wanted to be open to seeing what was in the data, regardless of their kind of frame of thinking about the data. And the software really facilitates that backwards and forwards, going from the kind of more deductive and inductive way of capturing. So validity checking is all to do with ensuring that the categories that are being developed are capturing what we intend them to capture, and that also all of the data segments that are being captured by the categories and the subcategories are equivalent. And that's a really key process of category building. So those validity checks were happening throughout the exploration, category building, category refinement stages. But at some point we had to stop the dictionary building process. We had lots of very interesting and quite animated discussions amongst the three of us about when we were going to stop this dictionary building process and apply the dictionary categories that had been developed to the qualitative data and move on. And that's in some respects a process that could be never ending, right? Because you can always refine your categories and think about them differently. But we did come to a point when we were like, okay, that's enough. We now need to move on and go back into QDA Miner so that we can start to think about what's going on in terms of these categories and how they are applied via the process of coding. So what happens with WordStat is that you can develop your dictionaries and of categories and subcategories, and we had quite a comprehensive and quite multi-leveled dictionary at the end of that stage 2, when we finally let ourselves stop it. And then we applied that dictionary back into the data in QDA Miner, and we did the coding based on the dictionary at the unit of meaning that we decided was the most meaningful, which for this data was the sentence. We again had quite a lot of discussions about whether paragraphs or sentences were most appropriate, but for various reasons we chose the sentences. And then we went through QDA Miner to review that coding. So the coding based on dictionaries that you develop in WordStat happens very quickly back into QDA Miner, but you don't just accept that, you then go and review that again. So we reviewed that again, and one of the key things we did was that we retrieved the responses that had not been coded by the dictionary categories that had been built. And that's a really important process to look at what hasn't been captured and whether there's anything that hasn't been captured that we do need to capture. So that's again where the balance between the human interpretation that Sture and Eric brought to the data is balanced with the power of the software. So those uncoded and coded responses were reviewed, revisited, on a question-by-question basis. We've got 4 open-ended questions, of course, so looking at that question by question, but also across all questions. And the coding is adjusted accordingly to kind of refine anything that the dictionary isn't capturing in quite the way that we, at this stage, felt it needed to. Part of that also was the idea that we needed to do a more narrative coding. So as well as capturing what was being discussed, so the dictionary categories that were developed are very good at capturing what is being discussed or mentioned in response to the open-ended questions. But we also realized that we were interested in capturing how these things were being discussed. And the decision was made earlier on in the process that that was going to be more appropriate to do that type of qualitative coding in a more manual way. So rather than trying to develop dictionaries to capture the how, we decided to do that by using the QDA Miner tools, retrieval tools. Cluster extraction was a particularly useful tool that we used for that, which I think Sturra will talk about shortly. So again, this is where we're kind of switching back over to QDA Miner and employing more of the human interpretation to build on the coding that had been developed out of the dictionary building. And again, consistency checks and reviewing the analytic plan was also key to this stage. Okay, so then we move on to the stage that Sturra and Eric are completing around about now, which is identifying patterns and relationships based on that coding that had happened in those 2 or 3 ways in the software. So interested in what is being discussed. So code frequency is really, really useful there because we have codes from the dictionaries that tell us what is being discussed in relation to the individual questions that were asked, but also more thematically across all questions. We're also interested in capturing related topics. So are there topics or aspects of habits that are being discussed that are related? So code co-occurrences are very powerful ways of picking out those commonalities or related overlapping topics. And then the third key thing that we were interested in terms of patterns and relationships on a quantitative level was to think about coding by variables. So Eric mentioned that socio-demographic characteristics of the respondents were collected. So we looked at how the coding related to those different variables. As part of the process of doing this, we realized that the contexts of the pandemic that were not necessarily contained within the data was something that we needed to also take account of. So herein comes the human interpretation aspect again. We had some really interesting conversations about what we're calling lockdown levels. So you may remember that Eric said that data had been collected from more than 25 different countries. And by the time we were at this stage, we were very aware that the approaches to lockdown had been very different in various different countries. So we wanted to think about categorizing the countries according to those lockdown levels. And that's something that we've been discussing and thinking in order to see whether the experience of habits is related at all to what's going on in terms of lockdown restrictions in different countries. And we're also talking about different age breakdowns than what we had at the outset that also reflect different contexts of pandemic. So that might be related to vaccines, etc., potentially. Okay, again, revisiting the analysis plan. So I'm going to move over and let Sturra talk a little bit about what was actually done in the software in a moment. But first, just to remind you that we're at this transitional point now between stage 5, identifying those patterns and relationships, which is happening on both a quantitative and a qualitative level, and starting to think about revisiting the starting point for this project, which was the conceptual framework that Eric talked about briefly earlier. So we're now at the stage when we're starting to think about how we're going to incorporate the model and look at the data again via the lens of the model in order to come up with some alternative interpretations. So that's kind of where we are at the moment. So my final point really to go back to the overarching view is you can see here on this slide that I've got some dotted vertical red lines in between stages 2 and 3, and then again between 4 and 5, and they kind of represent what became the key points at which we kind of changed direction or had to say, okay, enough of that, now we need to move on to that. And we found that quite a useful construct, thinking about, okay, although qualitative and mixed methods analysis happens iteratively, and you kind of your analysis develops as you go through that cycle, there are often moments of transition or break or changes in direction which are useful to reflect. And our current thinking about that is that the point at which we had to make the decision to stop dictionary building and to go back into QDAMiner and start to work in a slightly different way was one of those moments. And again, the moment we're at now in terms of the thinking about the qualitative and quantitative patterns and relationships that we are, or that Sture and Eric are identifying, and how that's going to relate to the next stages of the project. So, Sture, I have finished what I was going to say. So I now need to work out how I'm going to give you, okay, there we go. I'm going to give you control, which I think you have now got.
There you have it. Oh. Does this work?
We can see your PowerPoint, but not the presenter mode quite yet.
No, just a moment. There.
Perfect. Yeah, perfect.
Yeah. Okay, thank you. I will just start with a small correction. Not so small actually, but I'm not quite yet a doctor. I'm a PhD student, and hopefully this will take me one step closer to being a doctor. So being right. I will start by talking, or I will be more close to the actual process that we have been working in. Some things may be kind of coming back to what both Eric and Christina now has talked about, and hopefully perhaps giving the study a bit more, putting it more into a live mode, so to speak. Like Christina said, we went from QDAMiner into WordStat, and there we continue with the familiarization of the data. And that is, of course, an ongoing process, coming closer and closer to the data. And we used different tools within both, of course, first QDAMiner and later on WordStat to look at the data from many aspects. And finally, we had to decide where actually to go and to move on. And that is what also Christina talked about. We needed to learn the software so we could use the correct tools in the correct way to facilitate our intentions and needs, of course. So I'm going to show you also along the way a few screenshots of how things could be, how things looked in both WordStat and in QDAMiner. And also saying here from the beginning, the familiarization is, of course, the data is very text close now. That is what we're looking at. But we also decided to do the dictionary building after thinking about the pros and cons of doing that, knowing that it would be a lengthy process, of course, but we thought that the benefits were strong in that favor. When that started, we used some more specific tools, and frequencies is, of course, the first way to look at the data. And of course, there is just a whole bunch of that doesn't say very much, of course. It gives you some kind of feeling about what the main topics are. What? There's someone else with the mic.
You should really have. Oh, no, okay.
Okay.
And how to some message too.
So when we looked at the frequencies, that did not, of course, give us the words they are out of context. So we need to find out about each of these words, how they look in their respective context. So the keyword in context is a tool that we used a lot, going back and forth to the keyword in context. And here is one example of the word family and how it can look within this keyword in context. And here you can also see like the entry, the case 50 and 51 are similar. So we still need to clean the data, of course, but for some reason this happens in the data set. But then it's just to remove one of them, of course. But this is also a good way to find those things. Eventually everything hopefully reveals itself. So we went back and forth with this, and in some words there may be quite clear-cut about how to use them, but other words are kind of ambiguous. Take the word train, for instance, that we can have many different meanings, and specifically for us, it can mean to exercise, of course, and it can mean to use a train to commute. So we had to find out all those cases when train were used in either one way or the other, and we used proximity rules to aid in the so the correct paragraph sentences went to the correct place in our dictionary, of course. So back and forth with this dictionary and the keyword in context, and we also had lots of use with the tool to get suggestions about words. And here you can see, for instance, the word food, and the software gives some examples from the data where things may be found, and we looked up those one by one, and also looked at them in context to see if they were fitting in a code or in a kind of cluster. So, and also that gives us insights into how to find other nearly synonyms that is not covered by the software. So we tried a lot of different words and phrases to help in this dictionary building. And as Christina said, we went back and forth, and this is a small example of how the dictionary looked at some point, close to us going back into QDAMiner. And you have the different categories and subcategories, and you have the items. And this is kind of neat to have them all like this. And we also used, as Christina said, Excel to make it more easily to clean and rearrange the items and then put them back into WordStat, and that is really an easy process to do and helpful. And when we were satisfied with the dictionary, we were at this the red dotted line, and we decided to move the data and the dictionary into QDAMiner. And here we start fresh, kind of. You get an overview again. You have the data with a grid view in the center, and you can easily see exactly what people have said. And you can also see how they have been coded by the software. So this gives a good overview of how far we have gone and how it's looking at just this moment. Yeah, and also continue, as you see, in case 3 and 4 here, one of them, there is also a double thing that one has to be removed, of course. And the good thing here is that all parts are easily accessible. It's on the desktop all the time, and we can go back and forth and use tools when we need them, and they are like just a click away in the menu. And here we moved on in QDAMiner with using code frequencies and getting more familiarized with the data, but now on a different level, away a bit from the text and up to the codes. And here's just one example of how it all looks overall when we notice the frequencies. And we have spent a lot of time just looking at the numbers up and down and thinking and discussing and trying to get grips of how the data now is represented. And overall, you could see that something that stood out was that many people talked about physical activities in some ways. They talked about walking and exercising. And also relations were one cluster or codes that were very frequent. So they talked about physical activity, relations, and home. And this is kind of starting to be a kind of examples to follow, areas to investigate. We'll get more back to that also. So this is more of the what part. What are they talking about again, but now on a code and cluster level. And we also used variables. That was very interesting. We had a few demographics, and we have used age, for instance, and trying to find different kinds of doing variables with age. As you can see here, we have two. Like if you go from 70 to 79 or 75 to 84, you always have to make decisions. There is also this called generation, and that is generation X, generation Y, and so forth, and to see if that gives us any more information about the data. And we found a way to do another variable about countries. We have more than 25 countries, and we found statistics presented by BBC on how different countries had used national recommendations or lockdown strategies. And there were four. There were two types of lockdown. There were national lockdown or localized lockdown, and there were national recommendations and localized recommendations. And we sorted our countries along that model. And interestingly enough, there was just one country that had only used national recommendations, and that is Sweden. All other countries had some kind of lockdown. So that was kind of interesting. And 43% of the respondents are from Sweden. So it kind of split the data in two halves. And so it could be interesting to look at if there were any differences. We have find a few small differences with this variable, and that is that, let's see now, many talks about relations, but more in the national recommendations lockdown, meaning Sweden, talk about relations. And many in the lockdown or national and localized, they talk a lot about physical activity, and specifically about walking around. And you can imagine that if you are in lockdown, you may want to be able to walk around more, perhaps. And the co-occurrences, you can get co-occurrences tables like this and start to interpret these figures and get some clues about what topics occur at the same time. And overall, the most frequent code, that was meeting people in general, combined with experiences and entertainment, travel, and at work. So that is the meeting people thing has obviously changed a lot for many people during this pandemic. And more specifically, with the first question, that is new habits that you want to keep. There, many people talks about home and exercise and video calls and shopping. So perhaps there is new habits that actually work for a lot of people. There, you're able to shop and exercise from home via Zoom and other things. So this may be something to follow up, things you can do from home, and what people think about that. The second question is old habits that you want to review. And here people talked about meeting people in general and connect the co-occurrence with experience and entertainment, for instance, and eating and drinking. And perhaps that's not so surprising either, that if you're not able to meet people and experience nice things and go out and eat, you want to do that again. And the new habits to end, not surprised either, perhaps. They talk about home in connection with quarantined in home, and also to use different kind of hygiene protection things, masks and gloves. And this is what the new habits that many people want to end, perhaps in a way trying to live again a normal life like it was before the pandemic. And the fourth question was an open question, just other things they wanted to add. And here, surprisingly, many people talked about hedonistic things as like positive things. And perhaps this is a direction about there is hope in people's situation at this stage anyway. And like Eric said, we thought that this could be a short thing, and it turned out that that was not the case. But all in all, this comes back to the next step, crossing over the next red line, where data is on another level again. And so what we see when we have done this journey from beginning with lots of data, like Eric presented in the beginning, very unstructured, we have it more structured now. We have about 40 codes that still needs to be, of course, fewer. Most of the data is coded so far. We have a better understanding of the demographics, and more specifically, we have identified areas to investigate further. So we have an idea of where to go now, and also to go more from the computer to the human interpretation mode. So I will just end there.
Okay, thank you very much. If you would like to ask a question, please use the chat feature, which is the bubble in the upper right-hand corner of your screen, and type in a question, and we will give it to the presenters. The first question comes from Richard, and it says, do you believe the dictionary or part of the dictionary you created could be useful for further research of your own, or how about its usefulness for other researchers?
Well, I can answer that, and I think one aspect of building the dictionary was hopefully that we could use it again in some way at least, and perhaps also that others may have use for it. So that's part of the dictionary building process for us.
Okay, another question is, this is from Cynthia. I'd like to hear more about how the team approached the manual coding they did for the question of how was it said after the dictionary building. Did you review everything, a random subset, or groups of quotes based on dictionary coding?
We have gone back to the data again, and we will even more so do that now that we're going into the qualitative part of the coding. We will have to go back and really see how they are talking about these topics, of course. But we have been aided in kind of some directions. Perhaps not all of them will be successful, but certainly some will, I think.
I think to add upon what Sture said, one way to look at it is also to look at the code co-occurrences and see here is an interesting area where codes meet, and there's something interesting happening here, and then look at the actual quotes behind those occurrences.
Okay. And maybe this is to Christina, I'm not sure, but how useful was the software WordStat or QDA Miner in cleaning the data before the analysis?
I think part of the cleaning of the data happened in Excel first, but QDA Miner and WordStat can help you identify duplicates also. So I think Sture mentioned a couple of times that there are some duplicates that still need removing. So I think it's data cleaning is something that's always a useful exercise right at the outset in terms of part of preparing data for analysis. But I think also for example, finding responses that are nonsensical or somehow inappropriate or whatever it might be. Sometimes people fill out online surveys and write gobbledygook in there. So some of that can be identified in Excel, but you always miss things. So there's a special there are special tools that help you identify those kinds of things. And one of the nice things about WordStat and QDA Miner in my mind is it's easy to remove those when you find them through the process. So it doesn't have to be a one-time cleaning stage, as it were, because the data is always editable.
Okay. In QDA Miner, how did you decide whether to categorize information as variables versus codes?
So in terms of variables, those were the ones that we had already defined when we collected the data, like for instance the age or the country, etc. The codes were the ones which came from the dictionary. Sorry, this is your. You should describe this, Christina.
No, that's what I would have said. Maybe the question also belies the idea that you can turn codes into variables. So that might be part of the direction of the question, but what Eric said is how it was. The variables were the factual characteristics, which were predominantly or only in this data socio-demographic characteristics of the respondents, where our codes were where we were capturing what they were saying in a more sort of thematic sense, if you like, or content sense.
Okay. How would you approach your project if you didn't have WordStat or the creation of a dictionary?
I have honestly no idea. It's like a crazy amount of text. There's like, I'm not sure if there are 6,000 sentences or something. To do the line-by-line coding on this type of material would take an enormous amount of time. I don't think it would have been feasible to do such a project based on, for instance, line-by-line coding.
Okay. Well, we're kind of at the end of our time. So thank you very much for this presentation. We have some other questions here, and we'll try to get back to them individually. We will be posting a recording of this presentation on the webinar section of our website. If you missed a bit or would like to rewatch it later on, our next Lunch and Learn is scheduled for Tuesday, February 15th at the same time, 12 to 1 Eastern. The presentation will be given by Dr. Abby Jones and is titled, "What Are They Really Saying? Digging Down into Your Focus Group Data." You can register on the Learning webinar section of the Provalis Research website. So again, thank you very much for your participation, and we look forward to doing this again in 2 weeks, and we look forward to seeing you guys again too, and or really seeing what happens with your project when you're completely finished.
Thank you, and thank you for having us.
Okay, a pleasure. And as I said, the contact information for everybody is in the presentation, and you can get, if you need help with a project, you can get Christina's information on the training section of our website. So thanks very much, everybody, and have a good afternoon, evening, night, wherever you happen to be. Take care.